Howdy, everyone. Matt here. I got a question for you. What is the drawback, do you think, of a PT or OT calling themselves doctor? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic, or something from the physical therapy world. And this one came about from a video I saw here recently from a friend of mine. And they were saying, I am going to call myself doctor because I have a doctorate of occupational therapy. And whenever I see this, it starts this argument in the comments that I am going to say, and I will forever say, is the dumbest argument that comes about. And that is that, if you're a PT or an OT that has a doctorate of physical therapy or occupational therapy, you can't call yourself doctor. Okay, it starts this dumb argument, okay? It is. And I'm going to say two things about it. First off, if you're going to try to throw shade at me to be like, oh, you're probably one of the ones that call yourself I don't call myself doctor because I don't have a doctorate. I have a master's in physical therapy and I have my license to practice as a physical therapist. I do not have a doctorate of physical therapy, so therefore I do not call myself doctor. So if you're going to throw that insult, just hang on to it, okay? It didn't work. But second of all, doctor is the designation of a degree awarded, not a profession, okay? Now, yeah, people are going to be like, well, they assume it's a medical doctor. Okay, I'm going to talk about more of that here in a little bit, but that's also another dumb thing. Do you think people think that Dr. Jerry Punch, after the NASCAR race on Sunday, that he is going to do open heart surgery that week? Do you think an English professor that you had in college is going out and, working in a clinic and diagnosing people with strep or flu or whatever? Do you think they're doing that? No. People do have an understanding of a different type of doctorate. Okay. Now, granted, yes, when people say doctor, first thing that they do, I'm just going to say they can assume is a medical doctor, and very often people may correct it. But there's this other argument that comes up and that I think is silly. And I posted this on TikTok and it sparked a goofy conversation back and forth with an old guy that just was being stubborn. But people will say, you can't call yourself doctor because it's confusing the patients. Okay. With that being said, what are they going to be confused about? And what is the drawback to that? Okay. What's the next step or two beyond that? Okay. That they're going to get really confused about. Now, I think really it's only going to be in like a very, very like specific area where somebody's going to get confused. Okay. Like this is getting like really specific. Now, I'm going to say if you have a doctorate of PT or OT, but I'm going to kind of lean more into PT because that's what I am. I'm a PT. Okay. No shade at OTs or anyone else like that. I'm just going to lean more into PT. Okay. Because I'm Matt the PT. But if you have your doctorate of physical therapy and talk about a patient getting confused. So they go see an orthopedic, let's say, and the orthopedic goes, I am going to write you a prescription because you need to go to physical therapy. And I'm going to write the prescription for physical therapy. And then they send it off. And the person's like, okay, I need to be scheduled for physical therapy. And then this, somebody calls them from this place and it says, hi, I'm so-and-so from XYZ physical therapy. We're going to schedule you for your physical therapy appointment. Okay, we got your physical therapy appointment scheduled on this date. And then you show up to this clinic and it says physical therapy on there. Then you walk in the building and there's physical therapy everywhere. And then the paperwork that you're filling out says physical therapy, physical therapy, physical therapy. And then the pictures on the wall or the things with the physical therapists that are there says physical therapist and PT and has it all over. And then that person that sits down in front of them and introduces themselves as Dr. So-and-so, do you think they're going to get confused on that? Okay. Like, man, well, okay. They told me I was going to see a physical therapist. Why am I seeing a doctor? They don't care. Okay. I was going to tell you, they don't care. All right. Now, yes, granted, I can see that there are cases where this could be confusing, say in a hospital setting. Now, in a hospital setting, so inpatient, things like that, you have a lot of people like coming in and out. I've been in some of those settings. You're going to have physicians coming in, nurses coming in, respiratory therapy, maybe occupational therapy, speech therapy, PTs coming in there. You're going to have all these people coming in and out. But here's the thing. Yes, granted, very often in hospitals, they say only MDs or like a PhD or like having a terminal degree doctorate, you can reference yourself as doctor because they don't want that confusion. But however, whatever that you did, do the people, and if you work in a hospital setting, do you not let the person know what you do? Hi, I'm so-and-so with physical therapy. We're going to do your physical therapy. Hi, I'm with respiratory therapy. Do you not introduce yourself in that manner to let them know, hi, I am so-and-so from such and such, department, whatever that you're doing. Okay. You don't come and say, I'm Dr. So-and-so. And then you just go, no, you let them know. You don't understand why people are being confused about calling you a doctor? Hit that thumbs up button and hit that subscribe button. It's going to help out so much. Back to the video. And going over to this other aspect of it, that what's going to happen if a patient is confused about you? Are you not going to correct them on it? Are you going to go outside of your scope of practice? So say that you are in the hospital setting and the patient says, oh, doctor, you said you introduced yourself as Dr. Matt. Oh, well, I need more of my pain medication. I need this. Am I going to go, or you or whomever going to go, oh yeah, we can do that up and just go get that? No, you can't. That's practicing outside of your scope of practice. You're not going to do that, but you can let them know. Okay, I'll let your MD know about that. I will let them know. That's not something I do, but I will let them know. You're not going to step outside of your bound. Again, in the outpatient, patients get confused about that stuff. I've had them call and ask about stuff that's outside of what we do. I've had people think that I do physicals because of physical therapy. Oh, physical. We do physical. No, we don't do that. No. I've had people thought that it was like psychiatry. Just kind of seeing the name. I could say, okay, kind of confused on the name. No, that is not what we do. I had somebody call and asking about what to do because they had a possible STD. Oh, I have this. Did I say, yeah, come in here. We're going to, run some tests and write you a prescription for some antibiotics? No, not at all. We didn't do any of that stuff. We're not going to step outside of our bounds in it. Now, I will say, when we get into the stuff with the diagnostic of things, if a patient is sitting in front of me and they may say something like, hey, I'm dealing with possibly this, am I going to make a diagnosis about it? No, but maybe take a look at it and go, okay, you need to go see this physician. You need to go see that. I can direct you to who to this. That is outside of what I do. Okay. That is outside. I have a general knowledge, which somebody once told me, a thimble full of knowledge can do amazing things. Hey, I know that you need to go see this person. Is that really stepping out of my bounds? No, it's being helpful to someone rather than saying, oh, I don't do that. Good luck. Google it, figure it out. And then they just get bounced around in the healthcare system. So no, that doesn't happen. And if we're going to get on this thing of patient confusion, how often do patients already get confused? If you're an OT or PT, how often have you been referenced or called a nurse by a patient? Has a patient, oh, you're the nurse. How often has that happened? And then you corrected them. How often do nurses get confused with occupational or physical therapy, or the physician? Oh, you're the doctor. No. How often has a physician been confused for someone else? Especially, I have seen female physicians say, I have been confused as a patient, as a nurse, so many times by all sorts of. So there's already confusion going on. Patients are going to make it up with whatever and call people whatever. But you know what we do as healthcare providers? We correct them. Hey, no, that's not me. It's not what I do, because we're not going to step outside of our bounds. So I have this one aspect that I want to share. It's just a funny back and forth, and then I'll wrap this up. But I posed this question on TikTok. What is the drawback to that? To which some, older boomer man, they got an opinion. I've got an opinion, and my opinion is right, no matter if I'm shown to be wrong, but my opinion is still right. Okay, you know who these people are. But they comment. But when you say doctor to most patients, they think medical doctor. Okay, I talked about that earlier. It's all ego for PT. Just say I'm a doctor of physical therapy, solved. A doctor has a Juris Doctorate, but don't say I'm a doctor. So I was kind of picking up on that. What do you mean it's all ego? What part of it? What do you mean all ego there? And he said, because I know PTs with doctorate who think they're on the same level as a medical doctor. They're not. What's so wrong with saying I'm a doctor of physical therapy? It's too accurate. Okay, you're not addressing what I'm actually saying, and maybe this person had a poor interaction beforehand. But I asked, what do you mean you think they're on the same level? Like what does that mean? Can you say that a urologist can rehab someone back from a rotator cuff repair the same as a PT? Is that along the same lines of it? Or PTs overstepping their bounds? To which, again, he just dug his heels in. PTs go to school for 3 years with their rotations mixed theirs. MD go to med school for 4 years, then do the residency. Check out how long you're a urologist till they're ready to go. Then he gets into throwing political stuff into there, which is just stupid. So he's losing the argument. Okay, he's losing it. He won't go, address the actual aspects of it. He wants to try, okay, now let's turn this into a political argument, which, again, I'm like, okay, why did you make it political? And you're also avoiding the question. Okay, so that's just the goofy thing. And somebody like this kind of wraps this whole thing up. Okay. When people comment, going back to the beginning thing, calling yourself doctor, this and back and forth. And when somebody says, you shouldn't call your name, here's the thing. It doesn't change anybody's mind. Does it change your mind? If Joe here said, you shouldn't call yourself doctor, do you go, oh, he's so right. He's right. I should just not tell anybody that. Does that happen? No. When you look on social media and some PT who has a voice on social media says, I don't think any physical therapist should call themselves doctor, do you go, oh, thank you so much. I'm going to do that. No, it doesn't change anybody's mind when somebody says it. It doesn't. And I'm going to say this. If you want to call yourself doctor and you have a doctorate degree, call yourself doctor. If you don't want to, which people will say, I just don't feel the need for people to call me doctor. That's what most people that go by it will say. I just find it's fine. I just don't care for people if they want to or not. I'm not going to say either way. That's perfectly fine. You can do either one. It doesn't change. Then when you make a change, it is something that you have made over a period of time that you've thought, you've come to that conclusion. You've worked through so much to reach that. You didn't see some, Joe online or some whomever on Instagram say, don't call yourself, and go, oh, that's it right there. Now I will kind of wrap up with this aspect of it. It's so funny that people will say this stuff about PTs or OTs not calling themselves doctor, but yet will not push back when people use their doctorate unethically. I'm not going to say unethically, maybe questionably. When somebody is trying to sell themselves as a MD or a chiropractor, you see this, in which people, if you look in the comments, are like, it's always a chiropractor. But when they use that doctor title to sell some sort of, supplement. Oh, as a doctor, you need to use these supplements, which you happen to own the supplement. Oh, you need to do all of these tests that they are selling about. Oh, I'm going to get you to sign up to get my course. Why are we not pushing back against that? To say, you're using the term of doctor as an authoritative designation to try to sell something that is not good, is not correct. You should not be doing that. Why are we not calling out those when that happens? That's when we should be calling out. Who cares? If you have a doctorate in OT or PT and you want to call yourself doctor, call yourself doctor. If people have a problem with it, whomever has a problem with it, and they tell you shouldn't do that, the best response, you can either, you can hit them with a clap back, hit them with a good clap back, or you just go, okay. It ends the conversation. I gave you no fuel to argue because I'm not going to argue. Because if you say, well, I have a doctorate in physical therapy, well, no, because that's not, you just go, okay. And then you go about your merry way. And I'm going to tell you what, it bothers them more than anything because you acknowledge that they said it, you didn't accept it. They want an argument. But if you're going to say that, well, you can't call yourself doctor. Okay. Do-do-do-do-do. And I'm still doctor. Who cares what they say? Who cares? I didn't assign it any value. You gave me your opinion. Opinions are the cheapest commodity out there. They gave it to you for free. It didn't cost you anything. You don't have to value it whatsoever. Anyway, let me know your thoughts, opinions, beliefs, all that down in the comments. Do you think there's any drawback to calling yourself doctor? And if there is, what's the confusion? What is going to be the confusion? What is the drawback of it? Let me know that. Let's talk about it. Anyway, if you enjoyed the video, hit that thumbs up button and please subscribe to the channel. It doesn't cost you a copay or anything like that. And until next time, take care of yourself. Take care of your patients. I'll see you then.